My name is Pernille Weiss. I'm a member of the European Parliament and chair of the MEP Interest Group on Obesity and Health System Resilience. I'm also delighted to have been appointed as substitute member of the European Parliament Special Committee on COVID-19 pandemic, which had its first meeting this week. One of the core reasons for setting up the special committee has been that the pandemic has disproportionately affected vulnerable groups in Europe and globally. People living with obesity make up almost 60% of the EU population. In relation to COVID-19, they have 113% higher risk of being hospitalized and 84% higher mortality rate. Despite these facts, and although people living with obesity were rightly categorized as vulnerable by the European Commission and European Centre for Disease Prevention and Control in 2022, this categorization was never properly implemented at national level. So far, it has also not been actively taken into account by further actions at EU, national or territorial levels. I believe that now it is the time to, firstly, address obesity as a non-communicable disease in line with the European Commission's 2020 Strategic Foresight Report. Secondly, call for a special report on implementing obesity within the non-communicable disease framework, which should cover early diagnosis, treatment, long-term management, as well as the linkages to the more than 200 medical complications of obesity. And thirdly, create joined-up thinking and action around all policies which can impact health outcomes for people living with obesity in the current and next generation. I hope to take the first significant steps toward these actions through the new Special Committee on COVID-19 pandemic, and I invite my colleagues in the European Parliament as well as all stakeholders to take part in the efforts.